So could you tell us more about how neuroscience impacts how you treat people and how you see psychiatry as a field?
Absolutely. Absolutely. That's a wonderful question, Caroline. And essentially, as I said before, psychiatry can be both frustrating and exciting because it's really based on clinical observation. So we actually have no diagnostic tests that are brain-based that have any validity. So it's and also the brain is such a privileged organ. It's such a unique specialty in medicine because you don't have access to biopsy. So it makes knowing the underlying science background beneath the medical specialty, I think, mission critical to having a more effective way of approaching mental health. So, for example, for autism, that's a really strong example, but it's, like all mental health disorders, it's incredibly brain-based and it's incredibly genetically driven, arguably the most, probably about at least half the heritability for expression. And understanding neurocircuitry shifts and when they occur, it just gives you so much more power in terms of understanding like why a person's experiencing challenges and what to do in terms of available interventions, and understanding like developmental windows and when to do what, and what you would expect to see when. And it's just, I think it just helps so much. So the metaphor I like to use is that if, when you're using something like a DSM nosology, it's almost like the story of the blind men feeling an elephant and trying to guess what they're feeling, and each person feeling a different part of the elephant. And with the DSM, a lot of the differential between different disorders is reliant on that criterion B, associated symptoms. And that's a 5 out of 9 criteria. And I don't remember my factorials, but I don't know if that's close to 300 different permutations. And the underlying individual constructs actually overlap within disorders. So something that's reliant on like higher order circuitry and more complex processing is going to break easy. So the construct of attention is present across all the major psych disorders. So there's something called diagnostic creep as you get more severity, and you just get like a lack of clarity in the landscape right when you need clarity when things are difficult, because their severity of symptom triggers more symptom number. So the underlying neuroscience, I think, is I really feel it's totally changed the way I practice medicine, practice psychiatry. And I think it makes it a lot more fun because you can change outcome, I think, more effectively, more cleanly. And it's challenging because, and you guys are very fortunate to be studying neuroscience. You're actually not required to take a single neuroscience class to become a board certified child psychiatrist. They do test you on neuroscience, and the exam questions in neuroscience for board certification or maintenance, they're very, very like elementary, like stuff that you would probably be able to answer if you studied effectively, like at an undergrad level. So I don't know, I just think, and also it's such an incredibly interesting arena where like the more you learn, the more you definitely know you don't know that much. So you guys are lucky, you actually probably are getting a chance to look at molecular genetics quite a bit, but we didn't even have genome sequencing when I started, and all these new things like CRISPR, we didn't have that stuff. So thank God I started with PATH. But the neuroscience, I think, is amazing. In fact, for what I do for a living, psychiatry, the incoming class for a major, like a Top Gun academic program, about half their entry were MD, PhD for psych. And I think it's one of those specialties where it has so much transparency and awareness that obviously understanding the underlying brain basis for the expression and presentation of mental health, how could it not change outcome, So, it's really beautiful.